Gout is a form of arthritis characterized by sudden, severe attacks of pain, redness, and swelling in the joints. It is caused by the buildup of uric acid crystals in the joints, which leads to inflammation. Uric acid is a byproduct of the breakdown of purines, substances found in certain foods and produced naturally in the body. Symptoms: Gout typically manifests through acute episodes or flares. Common symptoms include severe joint pain, often begins suddenly, usually at night, and is most commonly felt in the big toe known as podagra. Other commonly affected joints include the ankles, knees, and elbows. Redness and swelling. The affected joint may become red, swollen, and warm to the touch. Tenderness. The joint is extremely sensitive, and even light pressure can cause severe pain. Limited range of motion. As the attack progresses, joint movement may become more restricted. Causes and risk factors: Gout is caused by elevated levels of uric acid in the blood, which form uric acid crystals that deposit in the joints. Several factors can contribute to high uric acid levels. Diet. Foods rich in purines, such as red meat, organ meats, shellfish, and certain types of fish, can increase uric acid levels. Alcohol, especially beer and sugary drinks containing high fructose corn syrup, can also raise uric acid levels. Obesity. Excess body weight can increase uric acid production and decrease its elimination by the kidneys. Medications. Certain diuretics, water pills, and medications used to treat high blood pressure can raise uric acid levels. Medical conditions. Conditions such as hypertension, diabetes, kidney disease, and metabolic syndrome can increase the risk of gout. Genetics. The family history of gout can increase your risk of developing the condition. Age and gender. Gout is more common in men, particularly between the ages of 30 and 50, though it can occur in women, especially after menopause. Diagnosis. Gout is diagnosed based on a combination of medical history, physical examination, and tests. Medical history and physical examination. The doctor will assess symptoms and examine the affected joint for signs of swelling, redness, and tenderness. Joint fluid test. The needle may be used to withdraw fluid from the affected joint arthrocenteses. The fluid is then examined under a microscope for the presence of uric acid crystals. Blood test. Measures uric acid levels in the blood, though elevated levels alone do not confirm gout, as they can be present without symptoms. Imaging tests. X-rays or ultrasound can help assess joint damage and detect the presence of uric acid crystals in the joints. Treatment. The treatment of gout focuses on managing symptoms during acute attacks and preventing future episodes by controlling uric acid levels. Treatment options include medications for acute attacks, non-steroidal anti-inflammatory drugs, and SAIDs such as ibuprofen or naproxen to reduce pain and inflammation. Colchicine reduces inflammation and pain, especially if started early in an attack. Corticosteroids, such as prednisone, to relieve inflammation when NSAIDs or colchicine are not effective or tolerated. Medications to lower uric acid levels. Xanthine oxidase inhibitors, such as allopurinol or febuxostat, reduce uric acid production. Uricosuric agents, such as propenicid, increase the elimination of uric acid by the kidneys. Lifestyle and dietary changes. Dietary modifications, reducing intake of purin-rich foods and alcohol, and avoiding sugary drinks. Weight management. Achieving and maintaining the healthy weight can help reduce uric acid levels. Hydration. Drinking plenty of water helps flush uric acid from the body. Monitoring and long-term management. Regular follow-up with a healthcare provider to monitor uric acid levels and adjust treatment as necessary. Prevention. To prevent gout attacks and manage the condition long-term, consider adhering to medications, following the prescribed medication regimens to keep uric acid levels in check. Healthy eating. maintaining a balanced diet with low purine content, avoiding alcohol, and reducing intake of high fructose corn syrup. Staying hydrated, drinking adequate water to help flush uric acid from the body. Regular exercise, engaging in regular physical activity to help maintain a healthy weight and overall well-being. Avoiding triggers, identifying and avoiding personal triggers for gout attacks, such as certain foods or medications. Conclusion: gout is a painful and potentially debilitating condition caused by elevated uric acid levels leading to crystal formation in the joints. With proper diagnosis, treatment, and lifestyle modifications, most people can manage their symptoms effectively and prevent future attacks. Regular monitoring and adherence to treatment plans are crucial for long-term management.